Hello, my name's Dr. Philip Memoli. I've been a holistic dentist for 30 years. I practice in Berkeley Heights, New Jersey. I've trained hundreds of dentists on amalgam removal and treatment of bite, jaw, gum problems. Uh, Today's discussion is causes of dental pain, tooth, muscle, or jaw joint. Now, why is this an important subject? It's an important subject because I get a lot of second opinions for tooth pain. And most of the people are coming to me because they've been told they need a root canal. And they're looking to see if there's an alternative. But in reality, what it boils down to is that if the tooth's alive, and if the tooth's alive and we can determine the cause, and we determine that cause is either from the muscle or jaw joint, then it's very likely that we can save this tooth and there'll be no need for a root canal, and that we can get rid of this pain. So in order to do this, what we need to first do is make an assessment, have an examination where we assess these things. Now, yes, studies have come out, dental studies have come out and said there's no correlation between the amount of pain that somebody's having and the condition of the nerve, which means that you could have severe pain in a tooth and think that this is a dead tooth, when in reality it could be a muscle or a joint referring pain to that tooth. So what we really need to do is do a jaw joint, a muscle examination, and a tooth examination. Now, the tooth examination, if we look on an x-ray and there's decay going into the nerve, or we see that there's evidence of a dead tooth like an abscess, at that point there is nothing that can be done. Okay, so these are things we need to rule out. So what we're going to do is we're going to say, okay, assuming that there's no abscess, assuming that there's no decay in this tooth, the next step is going to be, let's assess whether, even if I tap on that tooth, a lot of people tap on the tooth and it makes the pain intense. That doesn't necessarily mean the tooth's dead. It means the ligament around the tooth is inflamed. And that's primarily caused by an improper bite. So we're going to look at the bite, and one of the factors we're going to see with the bite is the person, half the time we do this, we put the person into the proper manipulation of the jaw, we relax the jaw muscles, we close the jaw, and inevitably half the people close on the tooth that's hurting. And that's the first tooth that's hitting. But we don't perceive that because our muscles are making our jaw close a certain way. So after we deprogram the muscles, we can see which tooth is really hitting first. And that could be as simple as making a bite adjustment. Okay, the other major issue with that is the condition of the muscles. Now, we can go in there, there's two major issues we want to see with muscles. One is, are these muscles, have they doubled or tripled in size? If they doubled or tripled in size, that's not caused. The studies show this isn't caused by you chewing all the time or chewing gum. This is stuff that you're doing at night. You may be going to that tooth and clenching on that tooth all night. Not even grinding, just clenching. When you clench, you won't even be aware that you're doing this. Okay, grinding leaves more symptoms and signs, like a flattened tooth. Okay, but if you clench, there's no signs. Okay, so the size of the muscles are going to tell us something. Then the other thing is when we palpate these muscles, okay, we're going to find there's certain points in these muscles called trigger points. If the trigger points are hurting, that means that muscle is going to contract and it's going to hit on that tooth maybe 10 times more, and that's going to cause that tooth to hurt. Okay, so if we make corrections to the bite or to the muscles, that's going to improve the situation. The key here is finding the cause of the tooth pain, not treating the pain, not treating the effect, treating the cause. Better yet, if you can treat both without losing the tooth. Okay, and finally, jaw joint problems. Okay, called TMJ, TMD, these sort of things. The jaw joints can, there's a variety of different things that happen to the jaw joints, and when these happen, it can cause you to hit harder on one side than the other. Okay, this is also going to cause problems. All right, so in summary, what we really need to do, there has to be a differential diagnosis of tooth pain. We have to find the cause, and we know what the effect is, it's the pain. But if the cause is determined not to be coming from the tooth, if it's in the muscles, okay, or if it's from the jaw joint, all right, these are things that can be treated very successfully. Again, assuming the tooth's alive and assuming there's no abscess. All right, so thank you for your time, and I hope you enjoyed this small video. Have a great day.